Dr. Nicole Ruyschaert, thank you so much for being here at our Congress, Mentales Stärken in Heidelberg. You are a psychiatrist, psychotherapist, former president of the European Society of Hypnosis, current board member of the International Society for Hypnosis. And what I found very impressive, you also created a training program how to integrate your Ericksonian hypnosis into solution-focused therapies and also hypnosis in general in medical settings. How can hypnosis be integrated in the medical field?
Well, in the medical field, we have a special training in the University Hospital in Belgium. It's hypnotic communication or positive communication in medical settings. That means that we teach nurses, medical doctors, anesthesiologists how to better communicate with their patients and how to avoid unwanted negative suggestions. So it's a very interesting difference that the doctor or the nurse can make just by being aware of their language and the way they often give these unwanted suggestions, like it won't hurt, it will give a little bit of pain, but just talking about pain, about hurt, or you don't have to be afraid. You emphasize the things you want to avoid. So we learn how to properly communicate, asking what you want and not what you don't want. I think all people have to face difficulties. We are living in difficult times, so many more people than those who are looking for help could benefit from the field of hypnosis and mental training. And I'm happy that I can bring knowledge and experience from different fields together now.
How open is the medical field to integrating hypnotic communication, positive communication, and what would you tell the skeptics?
Well, there is a positive evolution as we have more and more evidence from research, so that is very helpful, particularly as all over the world people have to cut on their budget and to restrict the budget. But when you can come up with some research data that it is really helpful and that you have even financial benefits and more comfort of clients, and also some research evidence that it really helps. We also have our results from MRI scanners, so then there is more openness. And we also have support from patients and clients who had a positive experience and who really will ask for that kind of therapy whenever possible. So there is this motivation coming from clients, motivating their medical doctors, their staff, to take the training and to be helped in a natural way without side effects from medicines and narcotics and general anesthesia.
Your workshop here at the Congress is about self-hypnosis and how self-hypnosis can help you achieve better results, achieve excellence. How can self-hypnosis help you?
Well, for self-hypnosis, first of all, you learn the hypnosis practice together with your psychotherapist or with your medical doctor, and step by step, depending on the reason why you have some problems with your performance, why you do not achieve at your best level, then you get familiar, you learn self-hypnosis and also different steps in that practice. For the workshop here, I will start with asking the participants, and that's also what you can do when you work with your clients, is to ask them to have a specific goal or an objective in mind. And when you practice hypnosis, you also can visualize that goal, associate yourself with it, and really feeling how it feels when you reach that goal, when you perform in a particular way, like succeeding in an exam, having a good sports performance, or a presentation that you give for a big audience and that you perform at your best level. Starting to imagine yourself you can do that is already a step forward, because as long as you cannot imagine that you will succeed, you will not succeed. Every change starts in your mind, and your body can follow your mind. When people do this practice and associate with really achieving, then sometimes something will come up, but that's not possible, that's not realistic, I cannot do that, or there will some cognitive restrictions or something like a negative self-talk that stops themselves, makes them feel anxious, or brings about some doubt about what they really can do, what they can do in real life. And that's very interesting, because there are more therapeutic work starts, because then we will try to find out where these obstacles come from and how they can change these obstacles, like how these stumbling stones on their way to success can be switched into something more helpful and a stepping stone to move forward.
In which way do you turn stumbling stones into stepping stones?
Well, there is an interesting work, like symbolic work. We will take these stones, and I have some concrete stones with me, and participants can work with it and project in those stones or find out the symbolic meaning of those stones. Is that something that a person said to me, a negative suggestion when I was young, like you will never succeed in life, you are a failure, you will never learn to be good in mathematics, or that's something you can't do that, or you don't have the physical qualities to become a good sporter. Like some negative things that are still there in the back of their mind, working at an unconscious level and stopping themselves from performing. And then we will make something like, how can you change that past, changing the history in a way that you have a better idea about yourself, that you feel more self-confident? Or what kind of help would have been helpful by then? Like, instead of someone telling you you will not perform, having a coach, a good friend, a parent who's there and who really supports you and makes you perform better or helps you out.
Now, when we're dealing with anxiety before exams, exams are usually a situation where you want to achieve excellence. How would you work with somebody to dissolve or resolve this anxiety?
First of all, it's interesting that this person learns self-hypnosis, and particularly a combination of being focused and bringing yourself in a good state of arousal. You don't have to be drowsy when you are there for an exam. You have to be alert, focused, not being disturbed by any doubts in your mind, but just focused and in a good state of alertness, that you have access to the necessary information you have in your mind. And they learn by a combination of first some progressive muscle relaxation, then this muscle relaxation combined with focus on a spot or a target, then combining this focus with the focus on reading when they are studying, and learn to study without distractions for a particular time span. And as they can do that, we also continue to find out how they can be more confident about what they have learned, that it can be available when they bring themselves back in that state of alert focus.
What are the benefits of active alert hypnosis as opposed to regular or Ericksonian hypnosis?
Mostly in Ericksonian hypnosis, it's working with metaphors, storytelling. People can also be there, eyes open, but they are fully absorbed in the story, in the imagination, in the associations they are making with that imagination. And the active alert hypnosis, your induction is different, because your induction will start with a proper focus, and when we have this focus, we activate some frontal parts of the brain, and then other parts deeper in the brain take over, and we have more associations and visualizations. So what's the benefit? That it's an eyes open hypnosis. It has many similarities with being in a state of flow, a natural trance experience that many sports people have when they perform at their best, and there is harmony, there is a kind of time distortion, there is sometimes amnesia after the performance, and that makes it an interesting, nice state that also brings about some positive emotions, because it's like being in an ecstasy. And when you are fully focused, you can enjoy what you are doing. And I think this alert active hypnosis, some people achieve that state in a natural way, others will do this proper induction. But when you have done that a few times, you can bring yourself all by that, back in that state, being focused. Tell yourself for a particular time span, I want to be focused on reading, on preparing that particular workshop, on doing this or that, and then it goes all easily by itself.
In your abstract for your workshop, you talked about inner likes. What are inner likes, and how do we create them for ourselves?
I think we all know about likes, and many people are quite dependent on likes they get from the world, and posting something on Facebook and waiting for answers, counting the likes, and if there are not enough, they feel somehow depressed or upset, or will try again, or question themselves. And these are all external things. You are dependent on others to feel well, and that's very temporarily that you get this attention from the outside or this positive appreciation, and it makes you quite vulnerable. It's far more interesting to have some inner self-confidence and the inner likes. And instead of blaming yourself when you make a mistake, you see that in tennis players often when they don't hit the ball in a proper way, or they miss a point, that they tell themselves, how stupid are you? How could you do it like that? Can't you be focused? So it's a kind of self-blame, and that interferes with your proper performance. The inner likes is a kind of some inner strength that you build, which is grounded, which you can rely on, and you can go inside yourself to reactivate this positive appreciation, an inner treasure. And it can be formed by previous things that you got, because when children grow up and in their development, the first thing they have is appreciation from their parents, being loved by parents or by people who take care of them. And that's the first basics of our self-confidence. And this is something that builds up and that can grow. So the inner likes became part of our inner self, and which are not temporarily there. And if people lack that, we can relieve these positive things in hypnosis. And as we relieve it, we also can bring up the feelings, the emotions, the cognitions, which are part of that experience, and anchor it. Connect it with a particular gesture, like caressing your cheek, or making a gesture like caressing your hands, and then completely relieving that inner strength or that inner confidence, positive, giving yourself likes and not being dependent on the likes from the world.